down some.
All right. And then do we want to go ahead? We can get started with going over our agenda and things. Dr. Muhammad, I'm sorry, Carrie, do you want to go ahead and take that on?
Sure. I'll go slowly just in case we still need to get Tonja on here. Hi, everyone. I'm glad you guys are here. Welcome. I was hearing Aisha mention where you all are from, so I'm glad you guys are here. Today for the DEI conversations, we have a very special guest. Her name's Tonja Myles. She's going to be talking about healthcare and mental health care in particular with the African-American community and other minority communities. And also talking about 988, which I don't know if you all know about that yet, but that is the upcoming 911 version for mental health. So welcome. Please feel free to ask questions. I'm going to ask you guys to go ahead and ask the questions in your chat box. I'm going to keep watch of that, and Aisha is also going to keep watch of that. That's better than raising your hand because we often can't see that because we don't see everybody. So we might miss your questions if you don't put it in the chat box, so please put it there. I believe we have another slide that talks about some of the things we need to do for keeping. I'm
sorry, am I not sharing again? I apologize. Hold on one second.
I see the agenda. I don't see the next one.
But, okay, so you see the agenda. Okay. Yeah. There we go.
So Dr. Muhammad is going to be leading this today. We just want to remind you of all the things that we usually do. Please be courteous, be polite, and use active listening. Reflect back what you hear. Avoid blame for anybody. Be respectful and be clear. Feel free to ask any questions. Just be respectful with them. Next slide. Do we have her? Oh, and Tonja is here. Yay. Welcome, Tonja. So for the best view of this meeting, we're going to actually pin some people to the board. So if you go up to your right hand, upper right hand corner of your screen, you'll see view. If you click side by side speaker view, that will give you Dr. Muhammad and Tonja. And that way you can also see the screen and just see those two. Again, do your questions through the chat, and Aisha and I will both watch for that. And I am now going to pass you over to Dr. Muhammad for the introduction of Tonja and for the enjoyment of same. Thanks for being here, guys.
You guys, I am so excited. We have an esteemed guest person with us. And when you hear this long introduction, you'll realize how privileged we truly are. So Tonja, I know you had technical difficulties. Glad you're here. So let me just introduce you to Tonja Myles. Tonja is an ordained minister, a community activist, peer counselor, veteran, subject matter expert in addiction, mental health, and untreated trauma. Tonja takes a faith-based approach to substance abuse recovery and sought after counsel for community-based public policy and system changes. She promotes mental health awareness and rehabilitation with sharing her life experiences as a recovering addict for more than 30 years. Suicide survivor, victim of childhood and adult sexual abuse, including her diagnosis of PTSD. Her story is shared in published books, magazines, documentaries, commercials, videos, and featured talk show guests and national television series. She is a passionate advocate of humane and ethical treatment of individuals with mental illness, substance abuse, sexual trauma, domestic abuse, and those formerly and currently incarcerated. Tonja Myles, unlike a clinical counselor, can openly share her lived experience in recovery while helping others change their lives. She is trained in mental health first aid for both adults and youth. Her role as a certified peer support specialist, which is an evidence-based best practice approach to treatment and recovery, is pertinent to the recovery team. Her role of peer specialist has emerged from reconnecting substance abuse and mental health treatment to the provision of ongoing support and recovery. She has moved thousands of people to sobriety and healthy, self-sustainable lifestyles with her resourcefulness, passion, and peer support services. As a result of her long-time work in social services, Tonja has developed an extensive network of community leaders, faith-based partners, public officials, law enforcement, and community resources. Tonja was recognized by President George W. Bush during his 2003 State of the Union speech to the nation. He acknowledged her perseverance and expertise in faith-based recovery, and she went on to become the face of the faith-based approach to substance abuse treatment for President Bush's administration for 6 years. In 2004, Tonja co-founded Free Indeed Treatment Center, which was the first licensed faith-based outpatient treatment center in the state of Louisiana. Free Indeed provided intensive outpatient treatment and support recovery services for individual and group therapy. The model was used to open many other faith-based treatment centers in the state of Louisiana and around the country. This program has enabled ex-offenders to receive transportation, transitional housing, job placement, and life skills through the Access to Recovery Grant. Wow, Tonja, what an impressive background. You know, we are privileged to have you with us, and I'm just so excited to hear your responses to our questions. But before I begin with my questions, I'd like to share this with everyone. Please keep in mind that the comments from Tonja are from her perspective, and they do not necessarily represent others. Please join me to welcome Tonja Myles. I'm so excited to have you.
Wow, thank you so much, Doc. I really appreciate that introduction.
Oh, it was very impressive. And as I previously stated, I'm going to be asking you a series of questions. So we'll begin with my first question. What gaps have you identified in minority healthcare?
Well, first of all, again, let me just say thank you so much, Dr. Muhammad, for, allowing me to be a part of this, and, the team that you work with. You guys are amazing, and I'm the one who's honored. I'm a team player, girl, and we all need each other. None of us can do this work by ourselves. So the work that you guys doing is amazing. The fact that you're having these conversations, we have to have them continuously. We've come a long way, but we still have a long way to go. So I just want to say, first of all, thank you so much, for real. Thank you for the introduction. There are so many gaps within the healthcare system. I know that, with this being Mental Health Awareness Month, I think of that, that's most near and dear to my heart. But, here's the deal, we have to start treating people not from the neck down, but from the brain down. And I think one of the disconnects as a whole is that we have to start looking at stuff as a holistic approach. healing is everybody's birthright. People have a right to heal. They have a right to good health care. They have a right to dignity and respect. And so, that's one of the gaps right there. It's the lack of respect when it comes to people who are Black and brown, or people that live in a zip code that's not like theirs, or might live across town. That's the main one, because when it's all said and done, we all want to be respected. And we are most vulnerable when we're in our healthcare issues. When we're having healthcare challenges, we're vulnerable. It's almost like, we're at the mercy of someone else, a doctor or a nurse or some kind of healthcare provider. So respect is the first thing. I know we're going to talk about, the lack of prevention, the lack of healthcare professionals in disenfranchised neighborhoods. Yes, that's one of the definitely a disconnect, but it has to be respecting people for who they are, not looking at if they have insurance, if they have Medicaid, if they look like me, do they have a mental health issue? Is it drugs? Because if it's drug related, then they probably deserve this. This probably didn't happen. And so we don't talk about that one enough. We talk about all the other disparities and things of that nature, but we have to start respecting people and meeting people where they are and realize that everybody has a right to heal.
Well, thank you. Thank you. And I certainly agree with everything that's been said. Respect is critically important. So how do you believe the gaps can be closed? I know you answered respect, but is there an example that you might provide of what the lack of respect means and how we might close it?
We definitely, know that racism is real, but also classism. The fact that a person does not have adequate health care, they get different treatment. In this field, I've been, fortunate to serve people from the curbside to the country club. And it's definitely different. It's different for, my white, sisters and brothers who can engage or enact and have, already probably have a good treatment team, if you will. They have someone that they can call, that primary care doctor, who will walk them through the necessary steps on what they need. And again, they're probably right at their footsteps, where in, communities of color, you don't have access to healthcare, you don't have clinics, you don't have prevention. We're not talking about space. You can't go within a 5-mile radius and maybe, find a place where you can get the necessary, help that you need. You have to go outside of your circle of influence or your comfort area to a place that, normally does not, serve people like, with Black or brown communities. So when you walk in the door, people are looking at you some kind of way, like, do you really, belong here? And so I think that, we have to talk about racism. We have to talk about how we change system. We have to talk about how, we even, engage doctors and nurses in recognizing that, I know what's best for me. You're well-educated, you're well-versed. I respect you as a doctor, but you have to listen to that person. A lot of times, again, we'll say, well, it's their fault because, they have high blood pressure, but is it really that? I mean, what about the area that I live in? Is there, a food desert where I can't get to adequate, a food source, where the only thing that I can eat is maybe fried food, or, you have the wonderful ability to go to a store and get fresh fruits and vegetables where I can't. I have to get canned food because of the area I live in. So we have to start talking about that. Are we making healthcare affordable? Yes. Are we making it available to people? That's a different story. We got to go to where the people are, meet them where they are, to get them the help that they need, and empower them to be the best version of themselves by, owning their own health.
That's interesting. You said, do we provide the health care that's needed? And then are we going to the communities to educate them? Mm-hmm. So are you saying that the healthcare is there for the poor, but yet no one is going out there to educate them on how to obtain that healthcare And I guess my other question is that healthcare affordable to someone who is unemployed and someone who is really down and in need?
Yeah, I mean, again, we have to go with people, or we have to think outside the box when it comes to healthcare. I know we talk a lot in mental health about integrative approach. We have to do that when we do make things available for people. If it's a neighborhood healthcare clinic, are they able to do a one-stop shop? Are they able to get everything that they need? In my community, we, have challenges with violence. So we're sending people out in the community to try to disrupt that, to educate people, to empower them. We need to do the same thing when it comes to healthcare. We need to see, there's so much data. We're data driven. I get that, but sometimes I'm data done. I'm just data done. Okay, you got the data from 20 years ago. So what are we doing with the data we had 20 years ago that says if you live in a certain area or a certain zip code, your life expectancy is probably going to be lower than someone else in another zip code? Then why is that? Let's look at that data. It's probably going to say because people lack of resources, that they're not able to go, in a 5-mile radius and maybe get the help that they need. Well, then guess what? Let's start putting resources in those communities. Let's start putting, health units. We used to have those back in the day. I remember that. Now we don't in a lot of places. We have to start meeting people where they are. We have to say, if we're going to really allow ourselves to be data driven, then let's go to those communities. Let's put those, even mobile units where people can get their, blood pressure checked, where if they're feeling some kind of way, they know that, that mobile unit is going to be here maybe on Monday, Wednesdays, and Fridays from 7 to 5. So I know that's my window of opportunity to go and, tell the doctor, nurse, look, I'm having issues. I'm having heart palpitations, or I'm feeling some kind of way. And then start helping people get those resources, engaging them, walking them through the process. Because a lot of people don't know the process of how you enter a healthcare system and how you navigate that. So we have to, make sure we give people that information.
I am so happy you said that. You made me think about a recent, well, not so recent, but at least a couple of years ago, pre-COVID, when even within my own community, the HOA was confronted with the issue of a new mental health clinic being erected in our neighborhood. And you would not believe the amount of pushback that was expressed to the board, because the board wanted to approve that. So everything is real. You're absolutely right. In order to close those gaps, we've got to be open, and we've got to be able to be courageous enough to say, obviously, if the data is there that supports that need, we need to meet the community based on that need. And that's critically important.
Exactly. And we got to hold people accountable. I mean, we really have to, if that's, if we're paying into a system, or we're part of the system that's supposed to be helping us, which we already know that there's a challenge right there, then again, what does that look like? I mean, if you know that, a person is having a challenge getting, to the doctor visit, or, some people are like, look, I know I need my medicine, but I also need to eat. That's real. And so we have to start looking at stuff at a holistic approach. We have to start looking at those, social determinants. We have to start looking at, okay, as a community, as a country, how do we take care of ourselves? Because look, we can say we're a great community, or we're a great country, but really when half of the population is not getting adequate health care, that people are not able to pick out a doctor or say, well, you know what, I should have that choice. Why not? I mean, why is it imposed on me for you to tell me what doctor I have to go to? I want to have more of a variety of a network of doctors that I know that is going to have good bedside manner. I never forget, we used to talk about that a lot. We want our doctors to be smart, but we also want them to be caring, going back to that respect. And not just when when you walk into the door, you barely look at me, you're just looking at a piece of paper. You're not hearing what I have to say. And look, we're gonna have to change that even when we talk to people about that. I never forget when I started really going to appointments with my grandmother and my mom. And so, I'm all about advocating, asking questions. And back in the day, you didn't ask doctors a question. You just kind of basically went off what they told you, and that was it, because the doctor knew best. And I think, we're going to have a different approach, even, as a community, on how we engage ourselves with the healthcare profession, knowing that we're the best, experts on ourselves, working with them, and making sure that, again, we give people every opportunity for resources, but then also help them how to navigate through the whole healthcare system to make sure they get what they want.
I couldn't have said it better. You mentioned something about you didn't ask doctors questions back in the day, and you're absolutely right. I'm a little bit older than you, but I do recall that. In fact, my husband, I noticed years ago when we first got together, when the doctor would come in the room, he would not look him directly in the eye. And I questioned him and I said, why aren't you looking at the doctor? He's talking to you. And later, he didn't say it in front of the doctor, but later he said, I grew up in a place where if you looked at someone of authority in the eye, it was considered confrontational. It was considered disrespectful. And it took a while to talk about that openly and talk about how to close that gap and to be very assertive in your needs. And so, and I can't say enough about what you said about questioning authority.
Yeah, and then just going back to gaps in access of care. I think about in the community that I live in the neighborhood that I grew up in. I can't tell you that there's a place where they're coming up, but not in a way that they should, where people can go into a unit or go into a doctor's office or urgent care and get the help that they need. Because again, they're not able to get there because they don't have transportation. They have to work, so the hours of operation are not good. And again, if I have a business, I know I want to be open where I can serve the people, because that's how I get compensated. So again, we're given a lot of tax breaks and tax credits and a lot of grants and things of that nature for people who are in the healthcare profession. But I think they need to be held accountable, that they need to make sure that they're reaching out to everybody, particularly in rural areas. There's not enough healthcare providers for people in rural areas. And so when we're as a state and as a nation, when we're giving people money to open up these spaces, we need to hold them accountable and make sure that they're doing them in places that are disenfranchised, that are needed the most.
That's a good comment there. So when you said hold them accountable, what steps would you recommend they take to hold that accountability gap, to close that? What steps can they take? Do they go to the government?
Well, I think one of the steps is, I guess, as being Dr. Rogers was said, who are the people in your neighborhood? I mean, just looking around our neighborhoods as we, drive, through them, past them, looking at what's available. I mean, looking to see, what do I might have a loved one in that area, just asking them. So, where do you go when you have a healthcare challenge? I never forget, we had when one of our, main hospitals were closed down in an area that was, needed it the most. There was nothing put in its place. And so we really had to rally together as a community and as a people and said, look, you took this out of, our neighborhood. So what are you going to put in its place? And so we had to, call our, state representatives, our council people and say, look, this is a hit on us. Where do we go from here? How do we work together? And that's what some of the things that we're going to have to do. We're going to have to, again, know what's really going on in our neighborhoods. If we don't live there anymore, I'm sure we have family and friends, even not. Most of us, on this, call, we love what we do. We're all about community. So, helping people engage and calling their state representative, calling their legislative, calling their, council person, saying, hey, we need to have more spaces and more places where people can go to get the help that they need. Because if not, we're a dying breed already. And, our life expectancy is already lower, than those who don't look like us. And so we need to bridge those gaps. We need to have those conversations, and we need to hold the people that we vote for accountable.
Thank you.
Because they're our voice.
That's right. That's right. So given your experience, why are you passionate about minority health care?
Because it should be fair. Again, healing is all our birthright. We all deserve that. We really do. There's no way we live in a country should live in a country where we have so many resources and we have so many sick people that are dying, not because they want to. People, for the most part, people want to be respected and they want to live a long life, a good quality of life. And so we should be, our brother's keeper, making sure that, that is done. So I'm passionate about it is because, like I said, I'm grateful that I get to serve an array of people, but I noticed there was a big difference if I'm sitting at the bedside of a white counterpart, who's having some health challenges that I'm called as a minister to pray for. I can, the room is different. The way the doctors and the nurses engage with that person is different when I've been in the, room with someone who lives in a zip code that's not like the person I just talked about. And the atmosphere is different. The quality of treatment is different. And that shouldn't be. It should be the same treatment for everyone. And I know most people going, well, you know what, that'll never happen. Well, why not? It goes back to, to respect and treating people with dignity when they're at their most vulnerable state. And that's when they're having a healthcare challenge. So that's one of the reasons. And, like I said, having a mom and grandmother who, were aging and had a lot of challenges and, being there when the doctor came in, or just a person, myself, when I'm, asking the doctor certain questions and, they come in there and they have 5 minutes because they got to have, 50 clients in one day. And I'm like, you might want to take a seat because I have questions. And to be, really, disrespected because how dare you question me? I'm not questioning you, sir. I'm just asking you, I'm part of my own treatment team and I need you to help me so I could be the best version of myself. And so I've had those interactions with doctor, not just, from a professional standpoint and for a ministry standpoint, but also from a personal one. I never forget my uncle, who I'm the medical power of attorney. He is schizophrenia, bipolar, and HIV. He's been in group homes most of my life. He was deemed criminally insane. And so when my mom and my grandmother died, no one was wanting to step up and take care of him, where of course I couldn't let that happen. Particularly, I work in this field, but my grandmother and my mom kind of hid my uncle's diagnosis because you don't talk about that. You don't talk about mental health. You don't talk about that stuff, because that's taboo on the family and, things of that nature. So I had to play catch up when it came to my uncle. And so I had to go get medical records and things like that. And I'll never forget, I guess right before COVID, he was in the hospital. And so when the doctor came in and said, well, we're going to put him on this. And I said, okay, that's great. Can you tell me what that is? And is it going to interfere with his mental health medicine? And the doctor said, what mental health medicine? I'm like, do you not know he's schizophrenia, HIV, and bipolar? No, how is that possible? You just looked at his chart. You just walked in the room. And so you're going to give him a medicine and you don't really know his history? Are you kidding me right now? But that happens more often. And I think a lot of times people are not expecting us to advocate for ourselves or advocate for our family members. And that's another thing, we have to have a conversation about.
When you said, he said, what mental health medication? I attended a conference, and the conference was called Doctor in the Mirror. And a black medical doctor was conducting a workshop, and he advised everyone, when you go to the doctor, take your brown paper bag with all your medications and show the doctor what you're taking, because oftentimes, even when they miss it on the chart, or or they're a specialist, they may give you a generic version of another version of medication you're taking, and you can double the dose and have a very adverse impact on your health unknowingly. So you saying being an advocate of your own personal health is critically important. And doctors, healthcare clinicians should come in with the expectation for questions and encourage questions. So
Right. And again, integrated care is the key. Again, we have to start, I can't say it enough. We have to start looking at people, from the brain down, not from the neck down or from the neck up, but a holistic approach. Because one thing affects the other. I'm reminded of someone who's telling me that, the doctor encouraged them, to get on, to make sure that they were taking their medicine for anxiety, make sure that they were taking it how they, needed to, because if not, it could affect the heart condition that they have. And everything's basically, all connected. And so, but again, having that one-stop shop for people is much needed. I mean, because again, people work, and I get that people have to work to live. And so we have to be mindful that, we need to remove the barriers as a healthcare system. As we're looking at this data and we're seeing people getting sicker, we need to be asking ourselves, well, why? And then what can we do about it? I know a lot of, I know I've talked to several doctors, and a lot of them don't take, Medicaid. And they're like, well, because the rates are so low and the paperwork is such a challenge. So, there are so many different things that, we have to look at. But I believe, having conversations like this, and really encouraging people and empower them how to advocate for themselves, and then how to make sure that the people that we voted in the office, because we know that our voting right is so near and dear and precious to us, but that's one day. We have to make sure that people stay accountable, those other 364 days a year that, besides the date we voted them in. And again, healthcare is key. I can't say it enough. I can't, that healing is our birthright. And if you ask a person, what they want to be respected. They want to be treated with dignity. They also want to be heard.
very, very, very true. So in what ways might RI employees work to minimize the gap in minority health care? And this is a message to all of us that are here. If you had to give the employees advice, what would that be to minimize that gap in minority health care? And you've already said a lot of what needs to happen already, but particularly to RI employees.
So again, my mom always told me that charity begins at home and spreads abroad. And so I think healing the house first, because we talk a lot about what we can do in community and what we can do on our jobs and what we can do in our country. And I'll get to that. But I think, the first thing is having conversations within our household. I know when we were at, dinners, we might hear that, Papa died of a heart attack, or, Grandma had those diabetes, but how do, we really have those conversations inside of our own house? For example, my brother, is a truck driver, and he had been having a lot of health challenges. And, he's been driving on the road for 13 years. And I had been telling him, you need to come home, you need to get, your health care, your medicines in check and stuff like that. And then he got real sick. And so before he got back on the road, I got with his kids and family members, and like, we need to have an intervention. We need to have a healthcare intervention. We normally think about interventions when it comes to, drugs and things of that nature. But this one was about his health, letting him know, look, we love you. We're grateful for the work that you do to help your family, but you have to take care of yourself. You have to make sure that, you're doing what you need to do, eating better, sleeping better. And if you need to come off the road, that's fine. So I think having those conversations first with, in our homes, I think that, RI, since we, this great organization that's, really leading mental health and substance abuse and crisis, again, integrative care, we need to make sure as we continue to build it, because they're going to come and do all this amazing work, that integrative care is really at the forefront, because that's going to help us help the guests that we serve, help the people that we serve, knowing that, yes, we're concerned about your mental health, well-being, but we also care about you from a holistic approach. And I think moving forward, as an organization and collectively as employees, making sure that that's always at the forefront, because one thing can affect the other. We're all of this is the way, our creator created it. It's all connected.
You're absolutely right. It's so easy to leave home in the morning and leave home in a bad place and carry that same attitude into the workplace, and it has a rippling effect not only on your peers but on those that you serve. And it's like you said, it starts at home. And when you said it starts at home, it resonated with me because I read your tips for healing circles. And so I mentioned that within my own family, and we're looking to start doing that. Can you share a little bit about a healing circle?
Yeah, a healing circle is basically just what it is. I had started, doing those in high schools about 2.5 years ago. But even before then, in 2016, we had a series of events that happened in our community. We had the Alton Sterling shooting, we had a police ambush, and we had the Great Flood. So our community experienced a lot of trauma. That's another thing we could spend a whole day talking about, is trauma. And so we had a lot of trauma. And so what we did is that we went out into the community. And we held healing circles in libraries, coffee shops. When you went to get your hair done, you could have a healing circle. So we went to where we knew where people were. We didn't say, look, we're going to have this healing circle and we want you to come to us. Because again, we know that might be a challenge for a lot of people. So we went to those places and those spaces to let people know, look, if you need somebody to talk to, we're here. We're going to be here this day and this time. And we did that for 2 years, and they were very successful. And so they kind of brought it out to where people were like, I want to have something, at school. I want to have something, at my job. How do I do that? How do I do a healing circle? And it's just what it says. It's an hour where you, empower, you encourage, you engage those you live with, those you work with. It might be your sorority group. It could be your book club, where, you just really sit down and everybody's doing a check-in. How are you doing? How are you doing mentally, physically, and spiritually? How can I help you? What are some of the things you're going through? Here are some coping techniques that I do. Are you sleeping? Are you eating right? Emotional eating, we know that's real. Are you making sure you're taking care of yourself? You're getting exercise. Or just say, what, I'm just here to listen. I got nothing but a good ear, and I want to let you know that you matter and that I hear you. And so those have been really successful. And so starting them in our house have been really cool, because it's given us a chance to, especially during COVID, to talk to our family members and ask them, how you really doing? How you really doing? And then when a person don't know, or, if you're not sure what that means, ask them to define it. My nephew always tell me, I'm doing good. I'm like, so what does good mean? Because it's different for some people. So, healing circles are very effective. They're non-judgmental. They're a safe space where you and your family can just share how you doing mentally, physically and spiritually.
Perfect. Thank you. I have one final question. Recently, we realized that there are social determinants associated with healthcare for minorities, many of which you've already shared. But what are your thoughts concerning moral determinants?
I mean, if we, when we talk about, moral, anything moral, we talk about right or wrong, good versus evil or sin. Well, it's a sin not to give people the health care that they need. It's a sin not to take care of people that, live, 2 streets down. It's a sin to know that, because a person, was born in a zip code. Nobody asked to be born in that zip code. And not saying that's a bad zip code, but that's where they are. And that if that does not affect us, as a people, as a country, then shame on us, because it should be, if we talk about, one nation under God, and we talked about, people being created equal, then they should be treated equal, particularly when it comes to healthcare and so many other different things. And so, we have to hold people accountable again. And look, we talk about racism, but classism is real. Just because a person does not live where you live, just because they don't dress like you dress, just because they don't worship like you, and you want to call that, that's, morally wrong, that's not good. That's not right at all. That's not treating people with dignity. That's not treating everybody equal. And so we have to address that. We have to talk about that. Racism is real. Systemic racism is real. And I'm so glad, we're having more open conversations, but we have to talk about, classism as well, because it is a little different. And so, we can't treat people different just because they were, born in Louisiana, and not in Utah. Or they, they go to a different kind of school, or they're not able to go to a private school and a public school. That doesn't make them better than, anybody else. And so we have to make sure that, we're, telling it like it is. We have to make sure we dismantle and disband, those things when it comes to us really serving people. It's really sad to think about that, we judge people based on what they don't have instead of trying to give them the things that they need.
I couldn't have said it better. I just wanted to say to you and to say to everyone on the call, my background is totally different than mental health and all the wonderful work that RI is doing, but I have been so educated and so profoundly affected by the wonderful work that David Covington and all of RI is doing. And I am just so passionate and so supportive of all the work that you guys are doing. So I share everything that you said, Tonja. I share the passion that you have as well. And I just feel so honored that you shared your perspectives with us. And now we're going to open the floor for questions in the chat room. Thank you so much, Tonja.
Thank you, Dr. Mom. I really appreciate it. Look, again, shout out to RI. Look, there's such a fresh air in our community, being the first stabilization center in the state of Louisiana. And we believe there are going to be many, many more. And even, changing our RI has been a game changer when it comes to, healthcare, particularly mental health and substance abuse, calling, the people that we serve guests, making sure that, we're trauma informed from the time that they walk in the door, and every experience is a good experience. And I think that if more healthcare professionals took that same approach like RI is doing, then, we will be having less and less of these conversations.
I echo that exactly. And a lot of that has to do with that passion and that drive that David Covington and the board brings to RI, and all the passionate employees who are just so committed. I just commend them all. You guys are awesome. So what questions do we have? Thank you, Tonja. What questions do we have in the chat room, Carrie, Aisha?
At the moment, there aren't any, so I'm encouraging people to please comments, questions, thoughts. Please feel free.
Well, I'll tell you,
We do have a question, sorry.
We do.
Yes, we do. It came to me in a direct message. That's why.
Oh, hey.
Yeah, it says, I've had many people of minorities accept me as a peer support specialist and a peer. What are some of the ways where I can be sure to continue this?
I think, by sharing, your story of hope, again, because if you're a peer support specialist, that means you have lived experience. And I think, just, telling your truth, engaging people, to, advocate, and be the best version of themselves, I think is just, legit. I think that also, looking for opportunities, to serve. There are so many, things that we do at RI, but, what about, in your community? You might maybe work outside of the space that you live. And, so how do I look for ways, in my circle of influence just to reach out to people to let them know that recovery is real, that my lived experience might be different, but you can be the best version of yourself, and offer them hope, offer them help, and let them know that, again, healing is real. And you're a testament to that.
yeah. Thank you.
Thank you.
Yeah.
Tonja, I had a question for you directly. How we were talking about education of communities for companies like RI, and we take such an innovative approach with the way that we deliver care, but what are some of the things that you would recommend as educational opportunities for a community, or ways that we can outreach better to the communities around the places that we have crisis and outpatient services?
I think that because there's no cookie cutter, outreach or treatment. Everybody's different, every community is different, and I think that's just starting with where you are. What are some of the resources that are out in the community? What are some of the or other organizations that are out there that are serving people that can help us, best serve people? If we're, know that we're good at, treatment, then let me see who's doing housing. Well, we know that people might have an issue getting to our treatment facility if we don't have mobile, then let me find out who's doing who's doing transportation. And I think when we begin to reach outside of the four walls like we already do, of course, we're going to do more of that. Then we can come together collectively, because like I think I started the conversation, we all need each other, and we have to work together for the sake of giving the people that we serve the best quality of life, the best service that we can possibly give them. So I think when we're reaching out like that, then we'll find out, oh, you know what, there are some gaps. Well, let me see how we can address those as a company. Let me see how we can work with organizations, maybe to bring things to the forefront. A lot of times, people don't know. And I believe when people are given, I have to believe that when they're given the opportunity to do better, they're going to do better. And so educating them on, what the needs are, from just the things that, we see ourselves every day. I think that's going to really, be a big help to everybody. It's not only going to educate, it's going to empower as well.
Great.
Thank you, Tonja. We do have a couple of questions that popped up in the chat. Jeffrey is asking, he says, I heard a mention of ministry. Do you believe there is more work to be done to bridge the place of worship, any form of religious practice, and service towards mental health?
Oh, yeah. Unfortunately, the faith-based community, we've kind of been, we've not been good at all. I never forget, one of my biggest issues why I didn't really come out with, that I was having some mental health issues, because, I was taught, that's the devil, that's just, that ain't God, and you need to suck it up, or, just, no, you just didn't talk about it. And then when you did talk about it, it wasn't looked at from a, healthcare perspective. It was I guess, going back to the moral, that we were talking about determinants, it was looked at more of a moral issue. I'm like, are you kidding me right now? And so we have to do better as a faith community to reach out to people, to talk about mental wellness. There are a lot of, people in, the Bible, and this is not a Bible study, but a lot of them had a lot of anxiety and depression, and so for us not to talk and say that that's not real, we got to do a better job. We really, really have to, and not, discourage people and not say, you're living in sin or you're, full of sin. That's why, you're acting like that. Again, we can't do that. And we really have to, as a faith community, be more open to, making sure that people get the right information, that they're loved and respected. Because look, you treat me different if I tell you if I'm having a issue with my heart, but when I'm telling you I'm having something with depression, you want to say that's moral or that's something different. And so we have to change that. And we got a lot of work to do in that area, not gonna lie.
Mm-hmm.
That makes me also think, I remember also being told that not only were you somehow almost possessed if you were struggling, but that psychiatry or going to counseling was a form of brainwashing, that the devil could get you that way as well. So there's definitely a need for more education within that realm.
It is. And, and therapy isn't scary. You can have, your spirituality and a therapist. I mean, it's okay. And so, for the longest we didn't have these conversations, we hadn't made a mainstream. You had a lot of, clergy who, death by suicide in the last couple of years. So now, they're forced to have these conversations. Or, you have a lot of people now who are celebrities, like Simone Biles. I think there's something that came out today that says, I know she's, not going to be competing on the women's team. And somebody was texting me and said that they think that she might be, jumping out altogether because she's having mental health issues. I'm going to be interested to see how people treat her, not only because of the color of her skin, but if she broke a leg or she said her leg was hurting, you wouldn't hold that against her. But now she's saying she's having some mental health issues. I'm already trying to, get myself in a good place, not to even, hit these knucklehead conversations.
Yeah, it's interesting. I did read the same thing, Tonja, and they said that she initially said she was overwhelmed with the stress of having to compete. And then later, her foot was wrapped up and she withdrew totally. So I'm interested in hearing those conversations as well. So
it's interesting. It's interesting.
Yeah.
Mary also has a question. She says, being older, I have experienced doctors treating me like I don't know what I'm talking about. How do I handle that where they listen to me?
Well, that's when you have to say, you know what, have a seat. We're going to be a while. And that's where, you have to say, look, if you're going to treat me, you're going to treat me, and you're going to see me and you're going to hear me. And, I think most doctors, I want to say that, and look, I know a lot of them, they have a quota. I get that, they have a lot of patients they have to see. I get that. But however, I'm just concerned about the one in the room, and that's me right now. And so it's okay to be selfish. It's okay to know he got other clients, but that's where, you're really going to have a conversation. And look, I even told the nurse one time, I said, I just want to let you know, I have a lot of questions for the doctor. So if I need to wait maybe 10 more minutes, but I'm going to need more than 5 minutes of his time. And they could not deny me that. And so I tell people that all the time, you let them know that, look, I have questions, I have concerns, and they can't run out the door and go, you know what, you're gonna have to come back with that. They have to, by moral law or, just being a good healthcare person. So.
I do understand Mary's comment about being an older person, and oftentimes the doctors want to kind of talk down to you as though you're not knowledgeable. And being tenacious is critically important, like Tonja said. Speak up and insist that they hear you out.
One doctor told me, said, you need to stay away from Wikipedia. I'm like, excuse me? I'm like, well, first of all, I know that Wikipedia is not credible. No. And yes, I did Google it. That's how we find out information. So it's not that I'm, I'm trying to, just what you're saying, but I'm just asking you, is there a better way for me? Or are there other options? So yeah, that's tacky, but a lot of them feel like that when you do say, look, I'm asking you questions. Oh, you're reading too much. No, I'm supposed to do my homework.
Mhm. I once had a doctor say to me that she was very appreciative of the fact that I came as an educated patient. And she asked me to please continue to do that, even if I had to put up a fight. So yeah, definitely.
Yeah.
I see Michael with his hand raised. I'm not sure, Michael, do you have a question or were you hoping to comment on something? And if you have a question,
Yeah,
can you?
I wanted to speak. First of all, I want to thank the panel here. I feel very blessed. I was doing something else, so I tested, is this a requirement? And it was brought back to me that yes, it's a requirement. So I stayed on, and I am blessed for staying on. I am blessed with the openness to talk about racism. That it wasn't shut down, that people didn't respond negative. Because it's a subject that needs to be approached. My mom deals with health issues, and I'm also a minister, a pastor. And so, I've been in the room where they have wanted to disconnect folks, and I fought for the folks to stay connected, and dealt with the family for the folks to stay connected. And the strange thing is each one that left their loved ones connected, because it was all about money. We don't want to keep them on the machine. You're costing the hospital money. They ain't got that kind of insurance to afford it. Them folks end up living. The ones where I wasn't able to get the families to stick with it, well, they disconnected them. So they'll never know. I had the doctor tell me one time, my mom said, get everybody together because she's not going to make it. And what really hurt me about this is my mom has worked all her life. She's got master degrees, so she done everything according to the American dream, and they cared not much for her health either, but I looked at the doctor and I told the doctor, I said, are you a person of faith? And she told me, yeah. I said, my mom's going to walk out here like she walked in here. That was approximately 4 years ago, and me and doctors go round and round. So my word to any of y'all that's got loved ones that's elderly, you be often there with them to stand up for them, because they will shove them to the side. If they ain't got the right insurance card, I don't care what they done gave to the community, they will shove them to the side. Now, I don't care if they got the right health card, their insurance is the right, then guess what? They're going to give them every chance they can to live. But if they don't, they throw them away like rags. And there's many times I've had to step in. My mom's been on life support 4 or 5 times. I was in the room one time when she coded out. And I was grateful for those who was about saving lives and not about money. So I really appreciated this. I'm very grateful for this. I'm glad that Jess told me I had to attend, because I'm so behind on stuff that I just want to do what I was doing. But I have been blessed. Thank you.
Thank you,
This
Michael.
is the power of conversations.
Yes.
Always be here. It's always a good thing. We do seem to have a lot of questions that deal with advocating. Another one that just came up with was, I help some of the people I work with to practice advocating for themselves and write down their questions ahead of time. But so often they have providers who will not listen or treat them as the human beings that they are. And when they ask for a new doctor, they're told that sure, they can ask to change, but nobody in their network is accepting new patients. This happens with various insurances and various networks. What else can they do?
Well, one of the things that they can do is the power of a review. It really goes a long way. I mean, for real. You'd be surprised how many people will write a review, and I'm that on a, healthcare professional, particular doctor or place or organization that's not doing, amazing work. People look at that. So you do have that power. That's one of the things. And then just finding out, even, from that, that managed care provider that you're in network with, finding and most of them do have a number where you can call if you have complaints about, somebody that's in their network. So those are 2 things that, I've told people to do, write that review. People really look at that. And then the other thing is, like I said, whatever HMO that you're under, you know, Blue Cross or Aetna or whatever, you know, Better Health, just, you know, go to them and find out, you know, if they have a space where you can call and when you have a complaint and a question about someone who's supposed to be providing, you know, adequate care for you or your family member.
Perfect.
Thank you. Someone else, Susan, actually kind of confirmed that same thing. She says, if you ask a doctor to document your requests, including medication or change of provider, et cetera, they are generally more responsive. They have to document it, and then it's in their records. So,
Yeah.
yeah. I don't see any other questions at the moment, just a lot of comments about, you know, gratitude and thanks, and how powerful this has been for people to listen to and be a part of. Do we have any last questions?
I just want to say to Tonja, this has been a wonderful 1 hour and almost 15 minutes of time spent having this conversation. Thank you so very much.
No, thank you guys. I mean, like I said, this is the thing that, you know, really changes, you know, cultures and conversations and having, you know, more spaces like this. So I'm just grateful that we're doing this. And I do believe it's going to make a difference in, you know, the people that we serve.
Carrie, I think I see a hand up for Shakur.
Yes. Matetwa, is that right?
Yeah,
Yes.
I'm here.
Go ahead.
Yes, I have a question. Does anybody experience overwhelming feedback from their clients concerning the way they being treated at social services? Because a lot of my clients is come back to me and tell me that they're not being treated properly when they go to social services to get some of the, especially if they're homeless and they're trying to get a voucher for either a motel or either get put in the shelter. They always come to me and tell me that the workers at social services talk to them very disrespectfully, especially when they find out they're homeless. And I'm just want to know if I'm experiencing this in Delaware or this is going on around the country. Like our clients is being, you know, talked down to with papers shoved in front of their face with no knowledge, especially if they got mental health issues. They don't understand what these people is talking about. And we have to eventually take them to social services, hold their hand, so to speak, and walk them through the process. But when the workers see us, they treat them a little better. So that's all I have at this time.
Can I
Okay.
respond to that?
I'm
Please.
not sure who's asking to
Sure.
respond, but go ahead.
Go ahead.
Okay. I go out, and when I'm not working with here, I go out and I feed the homeless. And I have had that same, and I'm in North Carolina, and I have had that same complaint over and over again, that when they go, or if like the weather is getting bad or something and they're trying to get in for, because a hurricane warning or whatever the case might be, they are treated, they say they feel like they're inhuman. That's why they won't go stay in some of the shelters, or they won't go to get the help, because they don't feel like people are treating them like human beings. They're treating them like they're nothing, and that's not so. Because when I go out and feed people, there's a whole lot of people that are homeless that are very well educated. They just, life circumstances took them there. So yeah, it's not just happening where you're at. It's happening in North Carolina. I've heard, I got family in New York. It's happening up there. It's happening when I talk to people, I'm finding that it's happening in a lot of places.
Just to add to that just a little bit, I have to say that's one of the powers that we have at RI. We have a whole team of peer counselors who who can go out with folks. I know that doesn't mean, you know, off hours, it's not always there. We can't necessarily always be with them 24/7, but that helps because a lot of what we're dealing with is education, right? This is what Tonja's been talking about. How do you educate? Well, one of the most powerful ways is through the peers that can go with the folks that we serve and can help remind the SHS or the other welfare services that are around, doctors, nurses, whatever it is. We can help remind them that a person who's sitting right in front of them is a human being. And over time, that helps educate them. And it helps also remind the people we serve, our participants, our guests, our clients. We remind them too in the process that they are human and they can reach out and speak up for themselves as well. So it's an ongoing process, I think. It happens everywhere. So yes.
There was something else that Tonja had said that I felt was really important to point out to everyone, whether that be in your personal life or professional, and that is, you know, there are rights that we all have as people, and a lot of our payers and insurance companies and things like that do have you know, a complaint or grievances type of line. And I think when you put it on paper, it does differently, especially with Tonja. I think she was talking about being data driven. A lot of the work in healthcare is being it's being recorded by the data that is being submitted. And so it's worth it to take the extra few minutes. That's another way that you advocate for yourself, is that it's documented when you call in, or if you have to send a letter, or if you have to, you know, those types of things of, you know, we talk about this when we talk about racism or anything like that. Like, staying silent says that you're complicit to how it's happening. So the more that you utilize your voice and you educate yourself on what resources are there to speak up when you need to, makes all the difference in the world. Because if they have a high influx of complaints, I guarantee you, from the work that I do as a contract as a director of contracts, like, I know they look at providers who have a high level of complaints and say, do these providers need to be in our network? Are they offering the best care and things like that? So there are ways to advocate for yourself in that capacity as well.
I think that's part of the education too, is it takes a whole lot of courage to step up and advocate for yourself. And when you have been beaten down so much by people's attitudes and things, it can be hard to do that. So that might be part of the places that we can go as well. And when we're helping people, is to start there and start helping them see their own courage and their own abilities and their own worth, so that they do feel that they can step forward. Yep.
All right. Well, thank you so much, Tonja, for joining us today for our DEI conversations. Thank you, Dr. Muhammad, for facilitating, Carrie for being my partner in watching the chat. Thank you for everybody who is attended and all your feedback and questions and things like that. And so we will wrap this up. Everybody have a wonderful day. We'll see you next month.
Bye.
Bye.
Bye.